kind of, we continue to make stories, right, as we live. And the story that we're all dealing with right now is the COVID-19 pandemic. So can you share briefly how that's affected your ministries, how it's challenged you, and if at all, what new opportunities have come up as a result?
Yes. Well, when the COVID-19, started in Haiti, one of the first things, we do, we call on our friends, those who are providing, help, to us to, we designed, first of all, a project to help, our people. And we started way at the school and also, the organization, Esperance Vie, we started a program providing a mask for the people. And with the help of very faithful, people, we made around 8,000 masks, first of all. And we gave them, to the people around not only Terre Rouge, but in a little bit farther in some other communities. And we taught them how to behave face to COVID-19. They have, to wash their hands. They have, to be careful with the distance, things, like that, and so on. Mm-hmm. So we were the first people to do that in Terre Rouge. And even, the mayor of Terre Rouge, came to us and asking, for help. And we still work in that area because in our school, we are the only school right now in Terre Rouge, which require that every single student, every teacher, everyone who is working with us wear a mask. And it has given us a lot of, we are very proud, of the work being done. And also when you go, to our clinic, everybody has, to wash their hands and also wear a mask. So this is one of the ways we are fighting COVID-19, in our area. And this also, well, although I have, to say, Haitians are very negligent in terms of wearing, the mask, things, like that. But we, in our community, we ask, our people to be very careful and to follow, those instructions.
Good. Rob, do you have anything to add around how your ministries were?
Yeah, I do. And I should probably preface this for people in the St. Andrews community that don't know that JP for a long time has been making soap.
Right.
And that is part of an initiative that was begun a number of years ago. And so we have staff that produce soap. It's handmade soap, but they're quite efficient and can produce a good bit of it. Anyway, so soap is, and hygiene is, of course, central to fighting the pandemic, along with the masks and the social distancing. So JP was able to respond to the crisis by delivering its soap products to hospitals, orphanages, homeless shelters, and remote rural villages. There's a big hospital in Milo, which is well thought of, and it is closer to Cap-Haïtien. And we've been providing all of the liquid soap, which is their preferred form of soap, for the hospital. And so with the surge in demand, it actually improved our production capacity. It challenged our soap makers to make more, make it better, and make it faster. So that was an opportunity that really actually helped the soap business. We call that soap business JP Savon. In other words, fulfilling a societal need actually improved its business. And this aligns with the goal of JP, which is to develop economic solutions that can support the people of Haiti and lift its rural communities out of poverty. Now, I want to just point out a small problem that we're having, and I'm throwing this out to the St. Andrews community to get their thoughts and ideas on. So one problem we have meeting the needs of the pandemic is that many institutions, like our own clinic, Espérance Vie, have difficulty affording the cost of the soap that we have to charge in order to cover the cost of making the soap. The soap requires a number of ingredients, and some of those ingredients are not available in Haiti and have to be purchased outside the country in the US. So, and then that is compounded, the price that we have to charge the soap from charge an institution like Espérance Vie for the soap also reflects the devaluation of the Haitian currency against the US dollar. So that means the products that JP Savon has to buy in the US, you know, it just costs a great deal compared to the amount of money that they're able to recover in the business in Haiti. So a solution that would be to find someone in the States, principally, who would subsidize the cost of the soap with a charitable donation. In other words, for example, a 50% charitable subsidy of 100 gallons of liquid soap would allow it to be sold for $11 a gallon instead of what we have to charge to cover our costs, which is $22 a gallon. So this would allow institutions like, there's a big homeless shelter in Cap-Haïtien that we've been providing hand soap to, and would allow them to buy the quantities that they really, really need in order to maintain good hygiene in the face of the pandemic threat. And, you know,